All right, good afternoon, everybody. Oh, come on. Good afternoon, everybody. Welcome to the White House. It is great to see you on this beautiful spring day as we celebrate 11 outstanding champions of change. Let's give them a round of applause, please. My name is Gautam Raghavan, and I serve as a liaison to the Asian American, Native Hawaiian, Pacific Islander community here in the White House Office of Public Engagement. A couple of years ago, we launched the Champions of Change program to salute the hard work, the tireless commitment, and the innovation of ordinary Americans doing extraordinary work all across the country. And in that time, we recognized community leaders for their work on bullying prevention and breast cancer awareness, for creating green jobs and advocating for women and girls in STEM fields, for mobilizing communities around critically important issues to our country like youth violence, prevention, and immigration reform. And about a year ago, I think some of you were here, we honored as Champions of Change an extraordinary group of AAPI women who are leaders in the arts, domestic violence prevention, immigration reform, education, and a number of other fields. So today's Champion of Change event is the latest in a series of events that we've had over the years, but I think it's particularly special to many of us here in this room and across the administration because of its importance to President Obama and his entire administration. Because thanks to the work of the champions that we are honoring today, plus actually many, if not all of you who are seated here in the audience, around this country, 8 million people have access to quality, affordable health care. So can we get a little bit of excitement about 8 million people? Come on. So that is something we should all feel incredibly proud about. But it didn't happen on its own, as you all know as well. And we know that when it comes to our community specifically, it didn't happen because of healthcare.gov or a funny PSA or a social media campaign, although all those things helped a great deal. It happened really because of the leadership of men and women like the champions that we're honoring today. It happened because community leaders and organizations stepped up, often with very limited resources, to ensure that Asian Americans, Native Hawaiians, Pacific Islanders knew about the benefits of the Affordable Care Act and how to enroll. So today, we here at the Office of Public Engagement are so happy to join with the White House Initiative on AAPIs and the Department of Health and Human Services to salute these 11 champions. And I think they would all agree that they are just a representative group. But there are countless more leaders and organizations all across the country who did incredibly important, innovative, smart work. So today we really honor and pay tribute to this whole movement that we've seen unfold before us. So with that, I want to get things rolling. And to kick the program off, we're so honored to invite up to the podium Dr. Nadine Gracia, who serves as Deputy Assistant Secretary and Director of the Office of Minority Health at HHS. So please join me in welcoming Dr. Gracia to the podium.
Thank you, Gautam, and good afternoon. It is really a pleasure to be here this afternoon, and I certainly want to echo and thank the White House Initiative on AAPIs, as well as the White House Office of Public Engagement for hosting this important event to honor Champions of Change. And you're certainly in for a great treat to have Dr. Howard Koh as your keynote speaker. What a wonderful day it is really to recognize the great work of our Champions of Change and really in doing so to honor what they have done to clearly address a critical need, which is addressing access to health coverage. One of the things that is one of the most significant factors that contribute to health disparities. And what an opportune time it is, now being in the month of April, which is National Minority Health Month. This year's theme of National Minority Health Month is Prevention is Power, taking action for health equity. And I must say that our Champions for Change did indeed take action. As Gautam stated, the President announced just last week the 8 million who have gained coverage because of the healthcare law. And this law is really providing an unprecedented opportunity for millions of Americans to gain and access quality, affordable health coverage that too often was out of reach. And it is one of the most important pieces of legislation in our nation's history that will help to reduce health disparities. We know that 2 million eligible uninsured Asian Americans, Native Hawaiians, and Pacific Islanders stood to gain access to new options for health coverage. For members of the NHPI community that already had coverage, they now have stronger protections, new consumer protections, such as recommended preventive services, such as blood pressure screenings, diabetes screenings that are now provided at no cost. That no one can be denied health coverage because of a pre-existing condition such as diabetes or liver disease, which we know significantly impacts the ANHPI community. We also know that people no longer have to worry about being covered when they get sick that they reach their lifetime limit for care because those limits are no longer allowed. And now millions of Americans across the country, including many members of the ANHPI community, have new affordable coverage options and the security and peace of mind that comes when you have health insurance. But as Gautam stated, this really would not have been possible without you. All of you who stepped up and really helped people to gain access to coverage, many for the first time, and in doing so in a way that you knew how to reach those diverse communities in a culturally and linguistically appropriate way. You took action for health equity. You sat patiently with people to explain and provide care for the needs that they have. You spent hours on the phone. You did all that you could to educate and enroll so many people, including those with limited English proficiency, those who are immigrants and refugees, those who are truly greatest in need. So while we can celebrate the many who have gained access to coverage, today we want to celebrate you. And the 8 million who have enrolled is really a true testament to the power of what can happen when we work together. So it's organizations like the Health Forum and APCHO, Sue Van and the Coulter Foundation, and the many local organizations and our champions who are here in this room. You are the embodiment of the spirit of collaboration and leadership that this country needs to address some of our most pressing issues, and in particular, pressing issues such as health disparities. Your passion, your dedication, and your commitment truly do not go unnoticed. But I must say that our work is not over. Now that the millions who have access to coverage, we have to ensure that those who are newly insured and those who are getting new protections under the health care law understand the benefits of this new law, that they also understand and are able to access care, because our communities will be stronger and healthier with the new tools and resources that are made available. So we look forward, certainly, to continuing to work with you, but today we pause and reflect and thank you. Thank you for your tireless efforts. Thank you for all the work that you have done to improve the health and well-being of the ANHPI community. You truly are champions of change, and we look forward to working with you in the days, the months, and the years ahead towards truly achieving our vision of a nation free of disparities in health and health care. Thank you, and congratulations.
Thank you, Dr. Gracia. And now I'm very pleased to bring up my colleague who serves as Deputy Director of the White House Initiative on AAPIs, or WEAPI as we like to call it. So please join me in welcoming Audrey Buring to the stage.
Good afternoon. I know, are we in the post-lunch coma phase? So I bet a lot of you didn't know that the White House Initiative on Asian Americans and Pacific Islanders is actually in the business of construction. So we build bridges and elevators. We build bridges between the federal government and the Asian American and Pacific Islander community so that resources are traveling from the federal government into the community, and the community is sending us recommendations, and all this is happening without encountering any traffic jams, hopefully. And then we build elevators where there are certain issues that are of such magnitude that they need to be raised and addressed at a higher level. And so one of the ways we do this is through agency plans. And it's not the sexiest thing in the whole world, but it means a lot. So we have partnerships with over 30 different federal offices and agencies. HHS is one of our strongest allies. And each agency puts together a plan on how they're going to improve services to our communities. And so it's very important that people visit these plans. We've just put the latest version up online at AAPI.ideascale.com. And now that the whole rush for enrollment is over, I encourage you to go take a look at particularly HHS's plan. Let them know there's a simple thumbs up, just like on Facebook. You can just like it and vote a goal up that you like. Or if there's something missing that you think should be in the plan, you should go ahead and write a comment right on the website. And so, of course, one of our key priorities and the president's priorities is increasing access to health care for all Americans. And you know, the Affordable Care Act is the president's his signature legislation, and it's moving the nation forward on increasing health disparities for all Americans, including the AAPI community. And so I know for me personally, I spent over 10 years uninsured because I was in and out of school, working odd jobs, and the problem is when you're uninsured, you don't go to the doctor because it costs a lot of money. And even when you do get insurance later on down the line, you've gotten to the terrible habit of not going to the doctor, and so it takes a lot to remember to go. And in fact, it was a few months ago that I went for the first time in 15 years for an annual checkup. And so I'm one of the easy ones, right? The AAPI community has so many more barriers that they have to overcome, things like language needs and cultural differences, lack of healthcare literacy, immigration status. And it's because of the Champions of Change today that the AAPI community was able to overcome these barriers and get insured, sometimes for the first time, or go to see a doctor for the first time in a very long time. So we're so excited to have you, Champions of Change, here today for your work tirelessly, making sure that AAPIs were getting insured and getting care on time and in language. We had probably 40 nominations for this Champions of Change, and it was so difficult to even narrow it down by one name. And in fact, one person traveled to rural communities to get them enrolled and to get them educated on the ACA, and 300 miles away from her home, and she didn't even make the cut today. And I think that says a lot about the people in the room and the kind of exemplary leadership you're showing in this whole movement. So we're heading into Asian Pacific American Heritage Month in about 2 weeks, and the theme of it is I Am Beyond. And so we'll be hosting an opening ceremony that I hope you all can make it to on Tuesday, May 6th in the morning. You can check it out at bit.ly/APAHM 2014, or just go to our Facebook page to check it out. But the theme, I Am Beyond, I think embodies exactly what the Champions of Change are. They are beyond, that you have gone beyond, and we thank you on behalf of the entire AAPI community. Thanks.
And if you missed that website, it's bit.ly/APAHM 2014. And we'll email it out to all of you, so you don't have to write it down right now. Next, we're so honored to have with us to give keynote remarks someone who probably doesn't need much of an introduction because you all know him as being a champion for our community, but also for healthcare in general. And so I'm very pleased to bring up to the stage Dr. Howard Koh, who serves as Assistant Secretary for Health at the Department of Health and Human Services. Please give him a warm round of applause.
So good afternoon, everyone. It's great to see you all. Welcome to the White House. Welcome to Washington. And I am so proud to be here today to say thank you and to recognize every person in the room who is a champion of change. We're singling out only 11, but everybody here is a leader and someone we're so grateful for. And I want to start by thanking the initiative to Kiran Ahuja and Audrey Buring, to Gautam Raghavan, who's a tireless champion for us day in and day out, to my wonderful colleagues at the Department of Health and Human Services, Dr. Nadine Gracia, Myra Alvarez, Noel Lee, Jonathan Beaton, and many others, and of course our Secretary Kathleen Sebelius, who is absolutely committed to eliminating health disparities, as you all are. But it's my main goal today to thank each and every one of you, because you have individually and collectively made a tremendous contribution to public health. On days like today, we can celebrate how far we have come as a country. On days like today, we can celebrate how far we have come as an Asian American, Native Hawaiian, and Pacific Islander community. And on days like today, we honor those in our community and in our families who journeyed to this country, endured sacrifices and struggles to find the American dream. I can speak about this because my family, like your family, has lived this journey. I'm a Korean American who has had the privilege of being born in the United States, but I have so many memories of seeing my grandparents, my aunts, my uncles, and other family members relocate from overseas to this country and become new Americans. It's memories like this that drive me every day in my job as Assistant Secretary. It's memories like this that made me so proud in the fall of 2009 to stand behind the President, along with my brother Harold Koh, who many of you know, who was at the time in the State Department, as President Obama signed the White House Initiative executive order and reestablished a focus on Asian American, Native Hawaiian, and Pacific Islander communities. And so we feel like we are living this American dream every day. And of course, part of that American dream is obtaining quality health care for everyone in our Asian American, Native Hawaiian, and Pacific Islander community. We are making tremendous progress. That's why we are here today. You've heard now a couple times of the President's announcement last week that we have enrolled some 8 million people in marketplaces around the country. And much of that success is because of you, because you have been champions and tireless leaders. Despite all the odds, you have persevered and exceeded everyone's expectations. Simply put, we could not have enrolled all these people without your hard work. And as I look around the room, I'm reminded of all the ways we individually and collectively have served as champions of change to promote the Affordable Care Act in our community. You participated in Google Hangouts in Korean, Vietnamese, and Chinese Mandarin to get the word out. I did one of those. I found out what a Google Hangout is. You held community enrollment events to walk individuals through the process of signing up for health coverage. Day after day and night after night, you also connected with individuals of limited English proficiency, explaining to them the benefits of enrollment in health coverage. And it was you, every person in this room, and so many others across the country who got the word out that 8 in 10 Asian Americans, Native Hawaiians, and Pacific Islanders were eligible for financial assistance in the marketplace. But ultimately, and most importantly, you didn't just help enroll people in insurance coverage, you gave people a fighting chance for better health. And that is a legacy that we all should be proud of, and you all should be proud of, something you should be proud of for the rest of your life. In fact, we're here today to send the message that the Affordable Care Act is not just about health insurance, it's about the promise of enjoying the gift of health for everyone. And so we are here to celebrate tremendous progress in public health today, and that's why we're grateful to each and every one of you. Now, some surveys estimate that we have, through this first open enrollment period, cut the number of uninsured individuals by almost 25%, which is astonishing. But so we have a lot more to go, but we can now begin to envision the real promise of the Affordable Care Act, which is better insurance, better care, and better prevention and public health. The theme of prevention in particular resonates with me as a physician who has cared for patients for over 30 years. As a physician, I saw time and again too many patients who were suffering preventable suffering and dying preventable death. Too many of them were uninsured or underinsured. And again, it's experiences like that have motivated me daily in this job as Assistant Secretary. Now, because of the Affordable Care Act, we can recognize and celebrate that there are essential health benefits that require individual and small group plans both inside and outside the marketplace to cover a comprehensive package of items and services for every person. But furthermore, I hope you all realize and understand that we have now over 100 million Americans who have access to high-value prevention services, like tobacco cessation services and certain cancer screenings under their existing plans without added cost. In short, the Affordable Care Act has removed cost as a barrier to accessing high-value prevention. That includes some 71 million Americans in private plans, 34 million covered by Medicare, and that's a huge advance for our country with respect to prevention and public health. Now, just in a couple of minutes, we're going to have some very exciting panels to discuss the impact of the Affordable Care Act in our community and in your specific communities around the country. And as Dr. Gracia mentioned, we have a great opportunity now to reduce health disparities and improve health equity from coast to coast. Reverend Martin Luther King liked to say that he wanted every person to enjoy what he called, quote, the sunlight of opportunity, unquote. I love that phrase. And you, being champions, have helped Asian Americans, Native Hawaiians, and Pacific Islanders enjoy that sunlight of opportunity. The Affordable Care Act does this in so many ways. We are now, for example, going into the 5th year of our Prevention and Public Health Fund, and it works to address not only health, but other factors related to our health, such as housing, education, transportation, quality, affordable food, conditions in the workplace and the environment. We like to say that health is not just what happens to you in a doctor's office, but instead health starts where people live, labor, learn, play, and pray. I made that up, so I'll say it again. Health starts where people live, labor, learn, play, and pray. So we have now, in this transformative time, an opportunity to talk about health in the most comprehensive way, dealing with traditional and non-traditional partners, and that's where being champions and being leaders comes in such a big way. You also hopefully know that because of the Affordable Care Act, we have funded community grants to many parts of the country focusing on tobacco control, obesity, issues that affect our community, diabetes, hepatitis, a big issue for the Asian American, Native Hawaiian, Pacific Islander community, all with the goal of eliminating health disparities. Now, one major reason we want to particularly honor each and every one of you is that you have made really heroic efforts to connect with people in a culturally and linguistically respectful way. And our country is getting more diverse by the day, and in the future, we have no other option as a society but to pay explicit attention to culturally and linguistically respectful and appropriate care for everyone. That's why last year our department, Dr. Grazzi and I and the secretary unveiled what we called enhanced class standards, standards for culturally and linguistically appropriate services in health and health care. And I hope you all have heard of the enhanced national class standards. These are intended to give a blueprint to healthcare providers and indeed all organizations to make their institutions more respectful of cultural and linguistic diversity. We need to raise awareness about themes like this from coast to coast, and we're depending on you to do that. Many of you have embraced the class standards, and we thank you, but we want to keep pushing that theme as we go forward. So we are very committed to advancing health with class, and that's the way I would summarize that very important theme. So as I close, we have embarked on an incredible journey together, but we're just at the beginning. We have so much to celebrate today. We want to thank each and every one of you for being such a champion, but there's so much more ahead. You are living, and we are living, in absolutely a historic time with respect to our country. And so that's why it's so exciting and so dynamic right now, and that's why we want to bring you here to DC to say thank you. Let me close with a wonderful saying that I think summarizes where we are, and the saying goes as follows. Everyone journeys to an end, but in the end, what matters is the journey. Thank you so much for being part of the journey, and we look forward to many more chapters in the future. Thank you very, very much.
Thanks, sir. Thank you, Dr. Ko, not just for taking the time to join us today, but for your leadership at HHS as well. So now we're going to do something a little fun, but before I do that, I just want to remind folks, for those of you who are on Twitter, who's on Twitter? Show of hands. So look, a lot of you are on Twitter, that if you'd like to tweet along, that we have a couple of hashtags that we suggest that you use, which are at the bottom of the screen here. One of the best things about working on this event has been getting the chance to work with Chris Harley at the White House Initiative on AAPIs. Chris is a senior advisor there and the point person on all things healthcare related. So it's been really fun to work together on getting this group together and hosting this event. And we're going to do a little bit of it's kind of like a diploma ceremony almost. Do you want to go ahead, Chris, and introduce it?
Yeah, hi, thank you, Gautam. And so we are really excited. We have a special surprise for all of our champions of change today. We actually have a letter signed by Secretary of Health and Human Services, Kathleen Sebelius, congratulating and thanking all of the champions for doing such a job well done and committing over the past 6 months to making sure that the Asian American, Native Hawaiian, and Pacific Islander community is being covered by the Affordable Care Act. So we're going to call you up one by one, and we would like to give you each of these letters.
And if you could actually stay on stage, then we're going to take a group picture while you're all up here together. So it's going to feel a little bit like high school graduation, but bear with us. And you're welcome and encouraged not to hold your applause until the end. So please, lots of applause for all of our champions. Doesn't matter if you don't know them, you will soon.
Is Dr. Ko still here?
I'm not sure. So we'll go back and forth, and we'll introduce them. So Sophie Duong, come on up. Yay! Minja Hong. Do you want to? Kathy Fan is actually not with us in person, but give her lots of applause. Hi, Kathy. We do have another Kathy with us, so Kathy, if you please come on up. Howard Ang. I guess, does this make me the principal if I'm the one? I don't know. Amy Jones, come on up. Ranjana Paintel, come on up. It actually feels a little bit like Price is Right, you know? Come on down. Teresita Batayola, please. Oh, yeah, sure.
Okay.
You do last three.
Priscilla Huang. Manju, oh, I have to wait.
Oh, what?
I'm gonna wait.
Oh, sorry.
Everybody get their full moment. Manju Kulkarni. And last but certainly not least, Bruce Thao.
Here you go. So why don't you guys, if you could arrange yourselves, somebody grab a seat real quick. Let me take these out of the way. Walk these out.
And while they're arranging themselves, I just want to read the letter because I think it really speaks to what this event is about. And it says, Dear Champion of Change, congratulations on your selection as a White House Champion of Change. Thank you for your outstanding efforts to educate Asian Americans, Native Hawaiians, and Pacific Islanders about the Affordable Care Act. With your help, more members of the AA-NHPI community will wake up each day with security and peace of mind knowing that they have health insurance. More than 8 million Americans have signed up for coverage through the health insurance marketplaces, and millions more have learned that they are eligible for Medicaid or CHIP, or are young adults who have coverage through their parents' health plans. We knew that success in this inaugural and historic open enrollment period under the Affordable Care Act would require the help of partners from across the country. You answered the call and stepped up to help the AA-NHPI community take advantage of the rights available to them under this law. Thank you again for all of the great work you do each and every day to advance the health and well-being of the AA-NHPI community and your commitment to making sure that more Americans have the opportunity to access affordable and quality health coverage. So thank you.
Let's give a round of applause.
So actually, Sophie, Minja, and Kathy can stay here because we're now going to start our panels.
Oh, she's coming.
Good afternoon. Hi, my name is Tuit Yung. I'm with the White House Initiative on Asian Americans and Pacific Islanders. I'm very honored and pleased to moderate our first panel of champions. I actually picked this panel because it has someone with my last name on it. I'm actually telling the truth. This is what happens behind the scenes at the initiative. So I'm really actually very honored, and I know it's really actually hard to enroll individuals. It's a challenge to explain the process to them. I helped my family members who just immigrated from Vietnam a couple of years ago through the exchange and through their Medicaid applications. And so I really do commend these individuals for their work. So these individuals, they found innovative and impressive ways to not only educate APIs about insurance, they actually enrolled them and got them health insurance. So I'm going to quickly read their bios, and they're each going to talk a little bit about their work, and then we'll show a video of our Houston winner, and then we'll go to Q&A with all of you and talk a little bit and share some ideas and best practices as well. So first up, we have Kathy Vu to my right. She is a program coordinator at Asian Services in Action Asia, Inc. In Cleveland, Ohio. She manages public health programs for Asia Inc. in Northeast Ohio and oversees Asia's statewide API outreach and enrollment efforts regarding the Affordable Care Act. Under her leadership, APIs in Ohio have multiple access points to affordable care coverage. And as many of you know, in the Midwest, there's less infrastructure for APIs, and so really, Kathy is probably a very, very valuable resource. Next, we have Minja Hong, Program Coordinator of Healthcare Access Services with the Korean Community Services of Metropolitan New York City in New York. In addition to her position with Korean Community Services of Metropolitan New York, Minja is also a state certified navigator for New York State and a certified application counselor for New Jersey. She has worked to organize large outreach and education events for Korean and Japanese American communities in these states, speaking at churches, community organizations, libraries, medical centers, hospitals, and fairs. So she really pounded the pavement in New York. So, yay. And then last but not least, someone with the Yung name, Sophie Yung, CEO and president of Nationwide Viet Radio from Falls Church, Virginia. Sophie, a media professional with over 30 years of experience, is the CEO and president of Nationwide Viet Radio, which provides news, music, entertainment, and educational programming for the Vietnamese American community in the Washington metropolitan area as well as worldwide. To address skepticism about the Affordable Care Act in the Vietnamese community, Sophie wrote newspaper articles, conducted TV and radio interviews, and created a walk-in center at her home business in Eden Center, an AAPI commercial center in Virginia to help sign up uninsured families. So that's really, really putting where your money with your mouth is, and that's just amazing that you offered up your business for the community. So thank you. So we'll start with Sophie over here on our far right. Sophie, why don't you tell us a little bit about your work, what motivated you, and your journey, and kind of your thoughts in reflection after this period of Affordable Care Act is over.
Good afternoon. I mean, it's such an honor and a pleasure to be up here. And, you know, I mean, it's really shocked and it's really unexpected to be here, but I'm so proud about all the support that I have it so I can come here today. So let me tell you about my story as an immigrant and a small woman-owned business myself. I understand that firsthand the challenges that all the immigrant businesses and employees and even that my Vietnamese people and Southeast Asian people that I have been helping them to enroll into APA, that we all face every day, the quality and the affordable healthcare that we don't have it before. So since, you know, we have the APA, is such a good opportunity that our people should enroll. But there is a lot of misinformation that people did not get enough information. And, you know, from bottom of my heart, I think that this is a good opportunity that I should step up. And then with my experience and with my certification of Obamacare, I should step up and then get the words out, and especially as the CEO of a media, of a radio. And I have a lot of support with my media worker as Mr. Vonyan here, he support me with TV, so we can have a lot of talk show. And with Mr. Alan Frank, he's right here too to support me. Without Alan Frank, I would not have, my radio station to turn as a walk-in center for all my Vietnamese people to get into the center. It's really easy for them to access every day, daily, so they can come to my radio station so I can enroll people. And a lot of support. Lin Huang is one of my radio associate. He has nominated me. When he nominated me, I say, just put my name, but I don't think that I will get it because I know that, a lot more people do much more than me. But I say, it's good to represent Vietnamese, and from my heart, I really want it because, it's something that I can stand up for my Vietnamese people. And I'm so proud that, I got selected, and thanks to White House and then the AAPI that has selected me so I can, be one of the 11 champion. So it's such an honor for me. So, it's proud to be here, and it's a lot of things that motivate me with a lot of things that I see with my eyes and my heart, that my people got insured, they cry, and a lot of people for years and years, they don't have insurance. So after they got the insurance card, they come to me, they cry, and then they show me as a good gift that they got it from the government. They say now, they feel really safe in their life that they have insurance. So I think it's a good thing that I do for the community. And last, just give me an opportunity to say thank you to my husband, Bill Dong, that he support me because I spent so much time.
Partners are
for-
champions too.
Yeah, for over 5 months that I didn't get home until like 1 or 2 a.m. in the morning. So thank you, Bill. And I want
Good
to
job.
thank you. My other is, he's a VP. He's my partner for radio. He has to take my work because, it's a lot of things that I slack with my radio program. So it's Mr. Wu, he's not here, but I want to say thank you. Thank you, Alan. Thank you, Yan, to support me on television. Thank you, Lynn. And thank you all the people, all my guests that come here and support me. Thank you.
In Vietnamese, we have the saying, "Sức khỏe là vàng," which
Yes.
is health is gold. And so I think this really, Sophie's heart really embodies, our values and what we care about the most. It's not about titles or money or anything. It's about your health and well-being. And so she just put out everything out there just to serve the community. So that's really admirable. Thank you again. So next up, we have Minja. Why don't you tell us a little bit about your journey and your reflections?
So again, good afternoon. Thank you all for coming out. My name is Minja Hong. I come from New York, but I also served as a navigator or a certified application counselor for New Jersey. How that came about is because although our offices are in New York, we saw the need across the state lines for the community members there who didn't really know where to go. And because New York and New Jersey were so integrated, the communities, they come for brunch to New York, or they go to work in New Jersey, or vice versa. And so many community members were confused. So we saw the need and we went there. And the biggest reflection that I have, having come, the 6 months of the open enrollment, is the power of many small voices coming together. I've had many colleagues come and say, well, New York, so many minorities, so many, established organizations, and this is true. But up until this point, I feel like a lot of us kind of had blinders on because, not in a bad way, because I myself, if you work with one community, you kind of, get a little bit, you have a narrower vision, a little bit of tunnel vision, working with just that community. But I think through this experience, through the ACA, through pooling our smaller resources together, coming together and creating larger results, Dr. Ko said earlier, places where you play and where you pray. Well, we went to the churches because we knew that those were the social gathering places of a lot of the Asian community. We went to the community centers where we knew that clients would come to get information on just what was happening, because they could read these things in the media, but they wanted a face-to-face connection when they came across to talk about something as personal as health. So I really, I myself, am a little overwhelmed by the selection, but also by the nomination. And the nomination moved me so much that, I made it a point to come here despite all of the, the after work of enrollment.
She's burnt out, that's what she's saying.
Yes,
Poor
that
thing.
is true too, but we still have a way to go. I think I'm good for a little bit longer, another 6
Joking.
months. So again, and one of the people that I really have to thank is the person who got me here. One of the many, who was part of the collaborative of Asian American community-based organizations who came together, got together funds to translate materials that were unavailable in other languages, or translate the materials that were available but were translated incorrectly. So we went ahead and translated them again. So I would really love to thank Ms. Suki Ports, who's in the audience today, who wrote this amazing letter that moved me to tears. So just, how much she felt that I had come to the aid of her community. And I personally thought that, it was such a privilege to work with Suki. It was such a privilege to work with all of the community members, all of the people who were part of Project Charge, which is our collaborative. They taught me so much. They motivated me. We could commiserate, but at the same time, we could see how this could move forward. So thank you all again for coming here, for listening to us, and I hope you have further follow-up questions later on.
Thank you. Thank you, Minja. It just brings me back to my days when I was on the ground in Houston and doing direct services, and it's really, really hard work. You are in the trenches. It's not like the nice life here in DC, although it's sometimes crazy too. Priscilla's like, what? But it is really hard, and you guys are really out there on the ground, and it is truly noble work. So next up, we have Kathy Vu from Ohio. So why don't you tell us a little bit about how it is like to work in a nonprofit in Ohio and the work that you've done and your reflections as you move forward.
Okay, great. Thank you very much. Before I begin, I just really want to say ocho, which means thank you in Hmong, to the White House and the U.S. Department of Health and Human Services for this honor. Just my own story, this country has been very good to me, my family. My parents are refugees who came to the United States. I was very fortunate to be born in the United States as well and live out the dream for them, because a lot of times they didn't get a chance to have the opportunities that I've had. And so today with this recognition, it's not only for me, but for the community, for my colleagues at Asia and AACS and ACA and my mentors, family, friends, and most importantly, my mother and father, who are the biggest motivators to the work that I do every day. So I also want to take a chance really quick to also thank Michael Bian, our executive director, who nominated me. He is like a mentor to me, so I'm very fortunate for that, along with our funders, who are the servant leaders of our community. At Asian Services in Action, our mission is to empower the Asian American and Pacific Islanders in Northeast Ohio to provide access to quality, culturally and linguistically appropriate information and services. And so through a partnership, what we did was we know that by ourselves in Asia, we are in Akron, Cleveland, with this. If you don't know what Ohio looks like, it kind of looks like a square, okay? So I feel like if you're not from the state, you don't know what the state really looks like. We were able to take care of Northeast Ohio. What we did from there was we reached out to two partner organizations who are also in the audience today. One of them named Asian American Community Services in Columbus, Ohio, and the other one, Asian Community Alliance in Cincinnati, Ohio. And through these three Tri-C cities is what we call it, Cleveland, Cincinnati, and Columbus, we were able to reach out to the Asian American, Native Hawaiian, Pacific Islander community to make sure that Ohio is covered and our community is not left behind, mainly because of the language barrier and the culture barrier. So through this partnership, we were able to meet our mission by ensuring that both Asians and non-Asians, because we don't turn anyone away who comes to our door, had access to culturally, linguistically appropriate information about the Affordable Care Act, and they also had the high-quality services to enroll in health insurance. So a big part, I guess, in terms of reflection for me was how everyone was just really hands on deck, like literally and figuratively, all hands on deck, from working extended hours to, filtering and simplifying the message and then simplifying it again and then simplifying it again, and just really, really tailoring the message to our community so that it could be fully understood. I could definitely say, even as someone who's, I would say, educated, health insurance confused me, and for the first time, I could confidently say that through the Affordable Care Act and through the program, the Navigator program, the Certified Application Counselor program, the public has a way to learn about health insurance in an unbiased, safe way that makes sense. And I think that's the beauty of what we are all doing and what all other communities, across the United States are doing with the Affordable Care Act. So the biggest reflection would just be how committed the community is to the community. And I'll stop there because I think we might have more to add.
Of course, yes. So I feel really humbled to just be with you all today. You guys, your passion and your dedication is really, really amazing. So I can see your hearts just out there, and so I'm very humbled, very, very humbled. So we have one more champion to hear from, and then we'll take your questions. So we have a special video from Kathy Fan of Hope Clinic from Houston, Texas. Houston is my hometown, so I'm really excited to see this video. And are we ready to go? She has a special message since she couldn't be here today.
Hope Clinic is a 501c3 nonprofit organization established by the Asian American Health Coalition. We are a federally qualified health center providing high-quality medical care for both adults and children of all ages. This past year, Hope has had the privilege of servicing our community by being a designated certified application counselor and providing in-person assistance to those needing help applying for the Marketplace Health Insurance. Being a certified application counselor myself, I was able to see firsthand how the healthcare law greatly benefited our community. My team and I were able to outreach over 8,000 people and help over 1,900 individuals gain access to healthcare. Our service area was mainly the greater Houston area, but we also had families from surrounding cities such as Austin, San Antonio, and Galveston and I'm the Outreach and Education Coordinator here at Hope Clinic in Houston, Texas. Hope Clinic is a 501c3 nonprofit organization established by the Asian American Health Coalition. We are a federally qualified health center providing high-quality medical care for both adults and children of all ages. This past year, Hope has had the privilege of servicing our community by being a designated certified application counselor site and providing in-person assistance to those needing help applying for the Marketplace Health Insurance. Being a certified application counselor myself, I was able to see firsthand how the healthcare law greatly benefited our community. My team and I were able to outreach over 8,000 people and help over 1,900 individuals gain access to healthcare. Our service area was mainly the greater Houston area, but we also had families from surrounding cities such as Austin, San Antonio, and Galveston who came to our clinic for assistance. Most of those people came because we had the capacity of serving people in over 14 different languages. These languages include Cantonese, Mandarin, Vietnamese, Spanish, Burmese, Arabic, and many more. All of these languages are provided in-house by our staff rather than having to use a language line, which creates a more welcoming and personal atmosphere. By working with the patients one-on-one, it brought me great joy to see how a client could walk away satisfied and relieved that they were finally able to be insured for the first time in their life. Though the process may have been tedious at times, it was definitely worth it to see a family and know how they could finally be treated for their chronic diseases and be able to see a doctor without fear of being turned away or not affording the visit. However, among all the great success stories, there are some heartbreaking stories as well. Texas is now only one of 4 states that still has not expanded Medicaid, and our community is definitely seeing the negative effects.
Approximately half of our clients we saw did not have an income high enough to qualify for tax credit through the marketplace, but they made too much to qualify for Medicaid. Having to explain this to them and knowing that they weren't able to get any health insurance was one of the hardest things I've ever had to do. But this disparity is what drives us for change. We encourage everyone who applied to vote for the Medicaid expansion. We help them register to vote, and we know that together we can change the fate of those who fall into the gap. Together we can be united and let our vote be our voice.
Round of applause.